This is Brother Medina for Tuesday, Seventh-day Adventist, and please let us start with a word of prayer. Loving Father, please be with us as we present these important facts. Bless everyone listening with good health and good decisions. In Jesus' holy name we pray. Amen. Well, today our study is Gardasil Danger Part 4. Gardasil Danger Part 4. And in this study, I am not going to speak much, but we are going to show you documentary footage of the wrong of Gardasil. This study is meant to show us that Merck generally performs bogus clinical trials with drugs and vaccines, with their drugs and vaccines. Point number 2, Merck falsifies clinical data to make their products look safe and efficacious when it really is not. Point number 3, Merck usually lies and cover up evidence about the dangerous effects and non-efficacy of their drugs and vaccines. And finally, point number 4, you must not trust Gardasil. Don't trust Gardasil, which was produced by Merck and misrepresented in their clinical trials. And this is what this program is to show you. Yes, my dear people, in this document here, the name of it is Merck Vaccine Fraud Exposed. We can see very carefully, let me quote for you. It says this: Merck knowingly falsified its mumps vaccine test results to fabricate a 95% efficacy rate. 2. In order to do this, Merck spiked the blood test with animal antibodies in order to artificially inflate the appearance of immune system antibodies. And that is what they did. So they actually put animal antibodies in the test to give the impression that the vaccine caused the production of more antibodies to be able to fight the virus. Furthermore, it says this: Merck also added animal antibodies to blood samples to achieve more favorable test results, though it knew that the human immune system would never produce such antibodies, and that the antibodies created in a laboratory testing scenario that did not in any way correspond to, correlate with, or represent real life. All this is what Merck did. And when Merck was found out with what they did, they falsified data to give the impression that they had fair and good clinical trials. All this was done with the mumps vaccine, and people still have the mumps vaccine. So Merck is a serial organization when it comes to doing wrong things with regards to their vaccines and their drugs. And in this first clip here, we want you to look at the US Congress having a hearing about Merck and the wrongs that they did with their Vioxx drug. So pay attention.
Dr. Castlebaum, I would like to talk about the importance of litigation in bringing information about drug safety to light. Recent publications have revealed safety problems with the drug Vioxx, and according to your testimony, the manufacturer delayed communications of known risk to the FDA and minimize those risks in its communication. So, Dr. Castlebaum, how did it do this?
What the manufacturer selected certain statistical tests that it knew or that have been shown to mask the types of outcomes and the adverse events that were showing up in the trials, and by choosing those statistical tests in its presentation to the FDA, led the risks of the drug to be underestimated by the FDA regulators, who would then read that report.
Now, would this information come to light without litigation?
The role of litigation after the fact was sort of to show both improper decision-making on behalf of the manufacturer and to show to reveal to the FDA the need to be more concerned in future instances when these sorts of cases occur, the need to be more vigilant and potentially try to dig deeper.
Again, my dear people, here is evidence that Merck deliberately covered up evidence of the danger of their Vioxx drug. Studies conducted by drug companies are not to be trusted unless independent data and independent studies are conducted. So Merck did not do independent studies. There were no independent studies. They were merely Merck-funded studies, and they covered up the results that showed that their things were wrong, their drug was wrong. Here is clear evidence in this clip.
These legal documents spell out what Merck knew and when they knew it. In clinical trials during the late 90s, the company tested whether their anti-inflammatory drug Vioxx could prevent cognitive decline in patients with Alzheimer's disease. Life-threatening risks were documented but were never reported to the FDA or the public.
The company found a threefold increased risk in mortality and failed to see a safety signal. By scientific standards, this is a major safety issue.
Dr. Bruce Pasady and colleagues at the University of Washington reviewed numerous legal documents from litigation involving Merck and Vioxx. In a published report in 2004, Merck reported that Vioxx is, quote, generally well tolerated by the elderly patients in our study. But this internal company document tells a different story. It reveals Merck knew about an increased risk in mortality associated with Vioxx, and they knew this in 2001.
If these findings had been made public back in 2001, many fewer people would have taken Vioxx, and because it is associated with an increased risk of mortality and of heart attacks, many fewer people would have been harmed.
In 2002, despite knowing the risk, Merck extended one of the clinical trials and even re-enrolled patients. During this time, 8 deaths were associated with the use of Vioxx.
Large clinical trials like these clearly need independent data and safety monitoring committees to protect the patients.
Dr. Pasady's review appears this week in JAMA, Journal of the American Medical Association.
The wisdom of allowing companies to control and analyze the data from their studies really comes under question when we have mortality findings that are concealed in this way.
Pasady says stricter regulations are necessary, not only to avoid selective reporting of results, but to help restore public trust. Jennifer Mitchell, The JAMA Report.
Yes, my dear people, it is sad to say this to you, but the facts are this. You need to know the truth. You need to be forewarned. It is your right to know these facts. The facts are that false data is a habit practiced by drug companies, including Merck, as a serial practitioner. So these false data, and as a habit practiced by these companies, renders their products unreliable, and especially Merck's products are unreliable. And this is the reason why you can't trust their Gardasil studies, because their Gardasil studies has a lot of false data with it. Take a look at what this clip tells us.
The evening. Busted. Scientists leave out data to produce bogus findings. The BMJ, which is the British Medical Journal, is sounding the alarm that data reported by scientists is too often not the truth because researchers leave out inconvenient data. Kind of like the inconvenient truth with Al Gore. Turns out that this is no once-in-a-while kind of problem either. The BMJ claims a large proportion of the evidence from human trials is unreported, and much of what is reported is done so inadequately. And then it goes in a little more commentary. Big Pharma's pills and potions are often pushed based on studies that simply ignore and leave out major data about what is really discovered about a medication lacking of benefits, potential dangerous side effects, and more. And 2 additional studies show the requirements for mandatory trial registration and timely sharing of results are poorly followed, if at all. And you know why this happens? I'm going to tell you why this happens. It's because most of these studies are paid for by the drug companies. And if you're a company that's receiving money from a drug company to do different types of studies, what are you going to do if you want to keep that contract? Well, you're going to get the results that they asked for. That's how it's done in this country. It's done with money. That's how elections are stolen, like what we saw in Iowa.
Now you would remember that India banned the use of Gardasil and stopped all these so-called clinical trials that were allegedly going on. Here is a video clip that will show you what happened in India. Again, here is further evidence that Gardasil does not work, and there's not a shred of evidence that it prevents cervical cancer. And this is based upon what happened in India. Take a look at this clip.
Professor Pollock, you have been working on the HPV issue. As you know, it was extremely controversial. The international NGO PATH organized, well, it's controversial what they call it. They said it was not a trial, but it was a trial in 2 states of India, Gujarat and Andhra Pradesh, where they immunized young girls for HPV vaccine, allegedly leading to the death of 7 children. It was controversial because of the deaths on the one hand. It was controversial because consent had not been taken from the parents of the girls, and nobody had been told they were on a trial. That has been suspended for now. You've looked and reviewed all the studies that went into making of the claim for HPV. Would you like to tell us something about your study?
Well, we really went back to very fundamental questions. One of the problems is we don't know whether HPV vaccine works, and we wouldn't ever know for 30 years. So basically, the vaccine is being rolled out on the basis of either proxy measures of outcome or titers, but not actually on real absolute decreases in deaths from cervical cancer. Now, the rationale for using HPV is to decrease the incidence of cervical cancer in the community. So in India, we wanted to look at, first of all, the claims that PATH had made. PATH was doing this study in 2 states. And it was interested in this study because it was claiming that the burden of cervical cancer was particularly high or above average in these 2 states. So we wanted to actually understand the basis for the cervical cancer data, but we also wanted to look at the HPV types, because the vaccines are only effective against a couple of the phage types, and there are many different phage types. So the first thing we did was to try and understand the cancer registration systems across India, which, as you know, it's a very big country, so they're very fragmented, but they're not universal. And the reason why they're not universal is, again, because you don't have universal health care. If you had universal health care, you would then be able to have really effective monitoring and cancer registry systems, but you can't. So that was the first big problem that we encountered. And so then we asked PATH for the evidence upon which they had based that claim, but that wasn't forthcoming. But it did lie in several documents from IARC and other major global cancer organizations. However, when we looked at the cancer registry data, we found that the cancer registries themselves were quite problematic in many states, either because they were based on small numbers, or they were very selective. They were coming out of hospitals or pathology laboratories, and they were not particularly population based. So there were issues about ascertainment, quality and validation. But we also found something quite interesting, which is that cervical cancer rates in any case, even given all these caveats about data, have been falling and are not particularly high in India. So, and particularly in the states that we were looking at. So we were rather puzzled about the claims that there was an extraordinary high burden of disease or above average burden of disease. So we do feel that if the basic epidemiological work had been done, then they would have picked up that cervical cancer rates are falling in any case. And secondly, there's a real issue anyway about the data quality and monitoring. And I would put it to you that it's highly unethical to introduce an intervention if you do not have the monitoring systems in place to see whether it's working. So first of all, there's no adequate monitoring systems to say that you've got a problem in the first place. And the data that you do have suggests that there really isn't a big problem from cervical cancer. You've got many, many more important problems, not least TB and malaria and malnutrition and diarrheal diseases. So that wouldn't be where I would put my money sitting here as a public health physician. So
a lot of money going
in there, but that would not be a priority area for me. And also, you don't have the data systems. There's a real ethical issue. about putting in a vaccine which you don't even know is going to work for over 30 years into states where in fact the epidemiology of the disease suggests the disease is declining naturally, we don't know why anyway. Thirdly, you have no means of monitoring, let alone adverse outcomes.
Even if it's successful, you don't
you don't even know if it's going to work. And now we have a similar parallel, of course, with our breast cancer screening programs in Europe. We introduced them over 20 years ago in Britain without properly good evidence that of an effect in terms of mortality. The Scandinavians have now shown that breast cancer screening probably has no effect at all on incidence or overall mortality, and indeed it may have several negative effects, both psychological harm, but also of course exposure to radiation, which of course again is a cancer hazard. So as a result of that some 25 years later, we're now reviewing the whole basis of our breast cancer screening program. Now, it's huge opportunity costs we're talking about. If you put money into, and this is a very, very expensive vaccine, it's the most expensive vaccine that we have. And if you put money into a vaccine, you should know that it works. And if you don't know that it works, then you have to be aware that there are huge opportunity costs because you're putting money into a vaccine program which then diverts resources away from other essential basic services, which don't just include treat drugs I'm talking about. I'm also talking about staff time, staff effort, counselling, the worried well, and what are children and women to make of this. So I think it's a highly irresponsible action that PATH actually went into that area without having got the basic epidemiology right. And that's in terms of the cervical cancer epidemiology. The other thing is in terms of the HPV types. The studies in India are very, very small, and in the healthy population, they do not again support a need for this vaccine. And I do hope that your government officials will read the paper when it finally comes out. It would have been very nice to have had it published here in India. And I hope that people will take the time. And this is a sort of really very important work because the vaccine market is expanding because vaccines are very attractive. They're attractive because you're going for a healthy, well, mass population of tens or hundreds of millions. So they're very attractive to the pharmaceutical industry. And they're attractive in terms of administration as well, because you're putting them into healthy people, so you don't need to worry about their care or their aftercare. But I put it to you, it's a huge irresponsibility if we go down the vaccine road without actually understanding whether these vaccines are appropriate, whether they work, and whether we've got the systems to pick up adverse events such as deaths or morbidity, and actually the long-term effectiveness. So, and it's not just HPV vaccine we have to be worried about. There are many other childhood vaccines that are coming out that we don't know whether they work and whether they're appropriate.
Yes, my dear people, do you see why we have been warning you? Do you see why you need to escape for your life? You have to be careful. No minister of health, no ministry of health should trust in a company like Merck, which is so shady and which cannot be trusted in the things that they're doing. In this clip here is a doctor that warns that the Gardasil vaccine is very dangerous. Take a look at this clip.
Hey everybody, Dr. Clark. New research has just popped up that shows, newsflash, the HPV vaccine is causing autoimmune reactions in certain people. Now, you shouldn't be surprised by that at all because vaccines of all kinds can cause autoimmune reactions. We're not talking about kids. We're talking about, not like little kids. We're talking about people in their 12, 13. Let's see what the age was. This study just came out of Germany. Investigators have identified cases of autoimmune disorders after immunization with the vaccine that begins with a G and ends with an Gardasil. Now, I'm probably going to get sued for saying that, but it's public record. It's right here. You should think long and hard about that. Now, I get it. HPV is related to developing cancer in women, and we certainly want to stamp that out. But you can't escape knowing this now. Now you know. You have to think about it. Do I want to do that? Do I want to have my daughter do that? Because do you really want them to have an autoimmune disease just so they don't get HPV? Now, there are some risk factors, and I'll tell you my totally functional opinion on this. If you've got someone that you want to give, you're considering getting the Gardasil with, there's some protocols you should probably do leading up to that. If there's a history of autoimmune diseases in that family at all, like if mom or dad has lupus, rheumatoid, or any previously identified autoimmune disease, there's no way I would let that kid have the vaccine that this study is talking about. Why? Because it's already known. You already know you're predisposed to having a hyperactive immune response, and giving someone a vaccine that's going to stimulate your immune system, that doesn't make any sense. Now, if there's not a family history, there are some things I would recommend doing in the weeks leading up to and the weeks leading afterwards to really lower the probability that they're going to get this autoimmune reaction. I was just reading again here. 2 groups presented on this subject at the meeting. One identified a case of multiple sclerosis after vaccination, and the second a case of neuromyelitis optica. All that means is brain inflammation after they got this vaccine. Now, if this is happening with this vaccine with kids that are not 2 and 18 months, what is happening? What is happening in kids that are that young and are getting vaccinations? I have a lot to say about this, and it's probably going to surprise you what I have to say. And we'll talk about this in a future post. But this is hardcore stuff. You need to know about it. You cannot walk through life thinking that everything that's on the market is totally safe. It's not going to hurt anybody, because that is BS, folks. You are the lab rat. I have news for you if you didn't already know it. When a medication or a vaccine gets released, that's when the real trials get done. That's when the real trials get done. And that's sad, and it's dangerous, and it should make you mad.
Yes, my dear people. And in this clip here is an exposure about the real facts of the HPV, the human papilloma virus, plus Gardasil. This person here explains it carefully. Take a look at the importance revealed here in this clip.
Now, what if everything you've been told about Gardasil and the HPV vaccines was a lie? What if it wasn't even true that HPV causes cervical cancer? What if the FDA knew years ago that HPV infections don't cause cancer, but they covered it up, refused to tell people about it? What if Gardasil was just pushed by pseudoscientific nonsense, complete junk science, and not only was useless in preventing cervical cancer, but was also potentially harmful to young women? What if all that were true? Well, I'm here to tell you today, I think it is true. We've all been lied to. We've been told that this virus causes cancer, and that in order to protect young girls from cancer, we have to give them a vaccine. Well, it turns out that not only is that not true, but in fact, these vaccines may cause an increase in the risk of precancerous lesions in young girls. Yes, you heard me correctly, that the vaccine may actually harm certain women. Now, here's a study that supports that. It's called the VRB-PAC background document. This is also on the FDA's website. I've got a link to it in my special report. And in this document, if you read carefully, you will find that the authors of this study are very concerned about the risk of harm to women who receive the vaccine. They even title it Concerns Regarding Primary Endpoint. And as it shows right here, what I've circled, observed efficacy is minus 44.6%. That means that the vaccine actually caused an increase in disease of 44.6%. Now, that's in certain subgroups of women. It's not in all women, certain groups, but it means that the vaccine potentially poses a serious risk of harm to some women. And we've been told this vaccine is perfectly safe, right? We've been told no problem, anyone can get the vaccine. They've even tried to promote this vaccine for young boys. Didn't anyone tell them boys don't have a cervix? So, these people are crazy. They just try to promote these drugs for anything. It's classic fear-mongering and classic disease-mongering for the sole purpose of selling more expensive pharmaceuticals and vaccines to people who don't need them.
Yes, my dear people, we have been showing you that you cannot trust Gardasil. In fact, the vaccine in this document here, 30 stunning facts they don't want you to know about Gardasil and the HPV vaccines. Here is exactly what we are told, I quote, "The vaccine Gardasil was fast-tracked. That was illegal. The Food and Drug Administration requires new vaccines to undergo testing and a waiting period of 4 years. Gardasil was developed and on the market in 6 months with FDA approval. Yes, my dear people, this clearly shows us that why you cannot trust Gardasil. Within 6 months it was created and was on the market for people to use, whereas the law stipulates that it should be a 4-year waiting while trial is going on. And there has been nothing such like that with Gardasil. This is the reason why we are asking you to take care of the lives of your children. Do not let your little girls get injected with this vaccine, which is not only so expensive, but which is so destructive to their health, as we have shown you. Now, everything that has been said here have been said for your benefit and for your blessing. No ill intent was meant to any organization, to the Ministry of Health, or anyone. It is just your right to know, so we told you these important things. And we hope that you make a proper judgment and be warned. So, in any case, Tuesday, Seventh-day Adventists have warned you. You have been warned by the Holy Spirit. Yes, my dear people. And until then, if you want this program with the others that has gone before, all you have to do is to call us at 625-0446. 625-0446, and we would give you this television program free of charge, plus the others that went before. And also, what you are seeing passing before the television screen here are our various web addresses. All you have to do is to tap into them to get further information. And until then, you have been warned. We hope you make the right decisions, and may God bless you as you make the right decisions. In Jesus' holy name, amen.